Hey guys, it's John DeYoung, and today I want to talk about ACL injury and repair. Most of the time when you see somebody who's a recreational athlete, a high school athlete, someone who does a lot of pivoting movements, kind of a college athlete, pro athlete, and they have an ACL injury, usually the recommendation is surgery to fix that ACL to get them back to their level of activity. That's an important factor in deciding if you need surgery or not. It's your level of activity. There's other factors too, which we'll get to. So now if you have a low demand athlete, somebody who likes to do yoga, maybe some volleyball, some jogging, and when they have an ACL injury, maybe physical therapy, activity modification, bracing. They make a brace that you put your leg into a cast that's specifically made for your leg. That works really well also. So possibly ACL surgery may not be a better option in that case. So that physical therapy can also get you back to your level of activity, where surgery would get somebody who's more of a pivoting exercise, pivoting a sport, has an ACL injury, they need to get back to that level. So surgery would probably suit them, where, again, if you're not doing that kind of activity, physical therapy may be the answer instead of surgery. You know, you're looking at sometimes the recovery from ACL surgery is 6 to 9 months maybe. But it does take, some time to do physical therapy and not have surgery to get you back to your level of activity, even if it's only yoga and jogging and things like that, not such aggressive pivoting sports. So the time factor is about the same. There is a higher incidence of re-tearing or injuring the ACL with non-surgical procedures. So keep that in the back of your head. Also, the age of the patient can also be a factor in deciding whether or not to have surgery. In addition to that, your doctor has to determine if there's additional damage to, say, meniscus tear or cartilage damage. Then you probably definitely have to have surgery because that's going to prevent any further damage. Sometimes if you tear cartilage, you have a free-floating piece of cartilage, that can actually start to do damage to other ligaments and more meniscus damage in the knee itself. So that's something you got to work on with your doctor. And according to the American Academy of Orthopedic Surgeons, about half of all ACL injuries occur with meniscus or other cartilage or ligament damage. So there's that. Also, some of you may have heard that ACL surgery can help prevent or reduce risk of arthritis in the future. And some of you may have heard the opposite, that not having ACL surgery will help you prevent having arthritis in the future. But unfortunately, your risk of getting arthritis has already been set at the moment of that injury. When you injure or tear your ACL, typically causes other changes in the knee, bone bruises, lots of inflammatory tissue. So there's a lot going on there, and it's a lot we don't know. It's kind of an individual basis. Depends on how you recover from it as far as physical therapy and surgery. It depends on moving forward, what kind of exercises and sports you decide to play. So if, I tore my left ACL 30 years ago. Now, I don't have arthritis as of yet, 30 years out, that's pretty good. I didn't have surgery, I chose physical therapy. I used bracing methods. I had that brace made specifically for my knee, so I used that for skiing. I feel that sometimes in the heavy snow, so the brace helps a lot with that anti-rotation. I don't need a brace when I surf and when I train, so kind of lucky. And then I tore my right ACL 25 years ago. I did do a graft. I did my own patella tendon graft. They take a little bone chip in the middle third of your patella tendon. By the way, that's the gold standard in ACL repair. That's called autograft, so it's actually autograph. It's from your own tissue. They do quadricep, hamstring, and patella. And again, the patella tendon is so far the gold standard still. And I'm 25 years out, and it feels great. I wish I had my left ACL fixed, but now over 50, pushing 55, I think it's a little late for that. I don't really want to go through that. But again, no arthritis. So I got lucky. I stopped running about 15 years ago. So again, be smart. There's a lot of different grafts out there. So again, the gold standard is the patella tendon graft, autograft of your own. You have cadaver, which is allografts, A-L-L-O. Now that's a cadaver ACL tendon. That works well. And sometimes they match different grafts with different ages. So say like a 50-something tennis player could probably do fine with an autographed patella tendon. That could be a cadaver one also. If it's a young kid, a kind of a college kid, or a really strong athlete, tennis, pivoting exercises, they're going to want to do your own tissue and a patella tendon graft. So again, things you're going to talk about with your doctor. A lot of different ones out there. The hamstring one I heard is really good, especially if you're only doing it from one hamstring. So things you need to talk to with your doctor, and be smart, take your time. It depends on the severity of the injury. So again, all right, guys, I hope this helped you out a lot. Again, you and your doctor should ask a lot of questions, do some research on your own as well, okay? Good luck with everything. Any questions, I'd love to hear it in the comments, and I'll talk to you soon, okay? Hit subscribe if you haven't already, and best of luck to you.